Good morning, Josh. How are you today?
Not bad. It's good.
Excellent. Okay, so today we're going to learn a new skill. We're going to learn how to don our pants. Okay. I'm going to use a couple of pieces of equipment. I'm going to use the dressing stick. Okay, and we're going to use our walker. And again, this is another skill that will help build towards your independence, so that you can dress your lower extremity following your total hip replacement surgery. Okay, again, yesterday, like with the shock aid, we just want to remember our hip precautions. So the main ones are, we don't want to flex those hips past 90 degrees, and we want to make sure that we're not twisting and rotating the trunk, because we don't want that surgery to be undone. Okay, so what we're going to do first is, I'm going to demonstrate the skill. Okay, go through each step. Then we're going to do it together, so we'll mirror each other's actions.
Alright.
And then finally, I'm going to ask you to perform the skill on your own. Okay?
Sounds good.
So to start with, when you take your pants, you want to make sure that you, first of all, have got them the right way round. So for sweatpants like this, we want to make sure that the ties are at the front. I'm just going to lay them out on the ground, making sure that the waistband is closest to us, the ties are facing upwards. And then with your dominant hand, we're going to take our dressing stick, take hold of the front of the waistband. We're going to work on an operated leg first. Okay? So you're going to slide your operated leg in there. You're going to pull up the pants.
A little twister.
So that you've got your leg main way through.
Okay.
Okay? Remembering those hip precautions of not flexing at the hips and not twisting.
Okay.
Next thing you're going to do is you're going to lower that waistband back down. We're going to get this non-operated leg in there. Okay, pull it up to a position where you can safely reach forward without flexing at the hips. Okay, now when we get to this point, set our dressing stick aside. We're going to work on getting our feet all the way through the pants, so that when we come to stand up and pull our pants up, we're not going to trip or fall. Okay, so once we have the pants to this position, we're going to take our walker and place it in front of us. We want to make sure that the walker is lined up straight. It's close enough so that when we stand up we can reach for it, but it's not too close that we don't fall over it.
Alright.
Okay, so from here, you're going to put your dominant hand on the arm of the chair, put your non-dominant hand on the waistband of your pants, and your non-operated leg is going to be your main weight bearer with your dominant hand. Okay, so you're going to push up, get to an upright position, remembering your hip precautions, not flexing, trying not to twist. Reach for that walker. When you get to the standing position, you're going to make sure that you're weight bearing on that non-operated leg. Okay? And then from there, we're going to work on pulling up the pants. If you need to, you can swap hands. Make sure that you get your pants pulled up properly and that you're comfortable. Okay? So from here to sit down, you're going to reach back with your dominant hand first, find the arm of the chair, reach back with your other arm, sorry. You're going to kick that leg out and sit down comfortably. Okay?
Okay.
And then from there, you can again move your walker out the way so that you are ready to do whatever you need to do next in your process.
Alright, sounds good.
Okay, so do you have any questions from my demonstration?
I didn't really see anything that I could think of.
Okay, so
Can we try it?
I'm going to take off these pants and then we will go through the process together, okay?
Alright, sounds good.
Excellent. Have you got your pants and your dressing stick already, Josh?
I do. They're right here.
Good
Got them all
man.
prepped and ready.
Good man. Remember to keep those hip precautions in mind. You don't want to twist your upper body. You don't want to flex your hips past 90 degrees. Okay. Again, as we go through this process, if you have any questions, don't be afraid to ask, okay?
Alright.
We'll go through it nice and slow because it is a new skill.
Okay.
It's not a race, we don't have to rush, we can take our time. We want to make sure that we do it safely, so that we're not getting any more injuries. So, starting with your pants, making sure that we've got them the right way round. So for our sweatpants, we want to have the ties at the front, okay? And we're just going to lay them out in front of us. Good, excellent. Waistband facing up.
Yep, that's what it looks like.
Yeah, front
Ties.
facing you, good job. Dressing stick, okay. Aiming for the middle of that top of the waistband. And then we're going to work our operated leg in there first. So nice and slow with that operated leg. When it's close enough, we can just give it a little pull. Okay, good man. Right, and then we're going to keep that dressing stick on the front waistband and lower it back down. And this time we're going to work in the non-operated leg. Now with your non-operated leg, you do have a little bit more movement, but you do want to make sure that you're not twisting those hips and that you're not flexing. So pulling it up. Again, when you get to a point where you can reach that waistband, you can get over with your hand. So you can put your dressing stick down.
Alright.
And work the leg of the pants up, remembering our hip precautions not to flex. Make sure that your feet come all the way through. Excellent. Doing a good job, Josh. Looks good.
Thank you.
Okay, so next step is our next piece of equipment. I'm going to take our walker, place that out in front of us. Okay, very good. And then it is dominant leg is going to be our main pushing leg, sorry, our non-operated leg. Dominant hand goes on the arm of our chair. Non-dominant hand is on the waistband of your pants, because when you stand up, you don't want your pants to come down and end up around your ankles. Won't do your hip precautions any good.
Alright.
Okay, so nice and easy. Push ourselves to a standing position. Off you go. Good. Transferring that dominant hand to the walker. Make sure you're weight bearing on your non-operated leg.
Alright.
Comfortable?
Yep.
Looks good. And we are going to work on pulling the pants up to a comfortable position. If you need to, you can swap your hands over. Remember to twist the pants and not your hips.
Yep.
Excellent. Okay, and then to sit down, you're going to reach back with your dominant hand for the arm of the chair. Kick out your operated leg, reach back with the other hand, and lower yourself gently and safely into the chair, remembering that main hip precaution of not flexing past 90 degrees.
Alright.
Okay, and then we move the walker out of the way, we move it clear so we can carry on. How did that feel?
I felt pretty confident in that. For like the pulling up with the stick, that I was a little weak on, I felt like, because I want to bend really bad, but I know I can't.
Well, from my point of view, it looks really good. You look confident. It was nice and slow. You weren't rushing. I could tell you were thinking through the steps.
Alright.
Okay, so it's an excellent job so far.
Okay.
The last thing is I'm going to hand it over to you, and I would like you to go through each step and give me the instructions as I gave to you. So explain to me what you're doing, if you could. Absolutely. I have every confidence, Josh. Take your time.
Alright, so starting out, I gotta get my pants, and then I have to make sure that they are pointed up, so my strings are facing up towards the ceiling, that way I can get my gripper in there later. Gotta lay them down on the ground.
Excellent.
Now, I have to take my dressing stick and grab the top of the waistband, about there. I start with my operated leg, my operated leg.
Excellent. Very good.
I put that one through. Try to drag it up with the dressing stick as best as I down, put my pants down. Now I have to put my non-operated leg through. So I have to drag this one up, so now I can drag both legs up. Kick this one around a little bit more. Doctors didn't tell me I couldn't. So now
Good job so far, Josh.
it's at a point where I can just use my hands, so I don't need the dressing stick anymore.
Fantastic.
I can just pull it up and through. Just gotta make sure my feet are clear so I don't trip later.
Brilliant, very good observation.
Alright, now this is about as far as I can get like that. Gotta grab the walker now. So can't twist. Walker is over and in place. Okay, now came the multi-step. I need to use my dominant hand and grab a hold of the chair. And then my non-operated leg gets all the way back. So I don't hurt my hip. I can't bend past 90 as I'm standing up. So, non-dominant hand, the free hand is holding the pants. Alright, here we go. Up. Transfer. And then just gonna sort of wiggle it up until I'm fully dressed. Leave it around. Make sure I don't get a wedgie. Alright, we're through. Now sitting down, I have to put my dominant hand down, right? Go from there.
Yeah.
So my dominant hand goes back to the wheelchair, and I just sort of slowly go into it. So I don't twist.
Good job. And what else are you trying not to do when you're sitting back?
I don't want to put my feet.
And you don't want to.
Bend past 90.
Excellent.
Like this, I have to get out of the way so I can wheel myself out.
You are ready to go.
Alright.
How did that feel?
I felt pretty good through it. I almost forgot one of the steps, so I was a little worried. But you definitely reassured me that I was doing well, and that helped.
You don't, as I said throughout, you don't need to worry about missing those steps because you're thinking about it. You're going nice and slow, which is good for your safety. And I'd say that was an excellent job. You concentrated. You were very wary of your hip precautions. Overall, you've done a good job. I think you're working very well towards independence. You've got the sock aid down, and now you've got putting your pants on. So you're doing an excellent job, Josh.